everybody, Corrie Sommers here. Today I have a special segment for you. A couple weeks ago I sat down with local Toluca Lake chiropractor, Dr. Saltman, who is amazing by the way, and he was discussing a new device that he has at his facility to help decompress and stretch out your spine, which is really great and important for getting nutrients back into your spine and relieving pressure and helping just the overall health with your spine. So, as a special treat for you guys, we filmed me demonstrating the machine and giving it a go, and I have to say it was truly amazing. Wait to the very end, see what it's all about, and I have some special information for you.
The lower harness.
Do I have to start? Okay. Oh, this is like we're getting ready to go skydiving.
Yeah.
So can you talk while you're doing this? Like explain a little bit about the machine and.
So the machine's a decompression. Mm-hmm. So that means it's not traction, or it's partially traction, but why they call it decompression is that it's pulling the vertebrae apart and then allowing it to relax. So it's pulling away and then contracting. What it's doing is creating a vacuum pressure, and what that does is it allows the nutrients that are in the body of the vertebrae to seep into the disc material. Mm-hmm. So we want to, and getting those nutrients back into the disc material will help heal the tears.
So let me ask you a question. Yeah. When I was little, my dad had one of those inversion tables.
Right.
So it kind of almost sounds a little similar, but
yes.
Just better?
Right.
Is that
better.
True?
Right. I mean, I think the inversion chairs, tables work great for certain types of low back pain. Mm-hmm. We've got an inversion thing in the back too.
Okay.
But like also with an inversion, you might only invert for 5 minutes at a time. Mm-hmm. You're going to get a 25-minute treatment. Mm-hmm. You know, so it's a longer, process, and there isn't a lot of I don't think good evidence that showed that herniated discs can get, repaired, from inversion. There's definitely some discs go back into place. I mean, there's so many little different nuances to disc tears, and whether it's a herniation, which is bigger than a bulge. There's so. And then some people have more than one level. I've got a patient now that's got 4 levels of herniation. Mm-hmm. So everybody's a little different, but in general, I mean, I think the inversion tables are great, and I think for lower level chronic back pain, they're fine. This is for generally a little more serious type. These are for patients that are maybe near surgery type of conditions.
So give some examples of. You just did say disc bulging and hernias, and what else is this really good to help? Like if someone was in an accident or has a slipped disc, how?
Well, that's the same. What you call a slipped disc is a herniated or a bulge, or So bulge is less of a injury. Herniations, next level, and and then ruptures like another hole.
So I know this is very good for the spine. Is this also going to help with my neck, or is that a different?
That part of the unit's for the neck.
Okay.
So and there are many patients that have to come in and use, do it for their neck and separately. But yes, if we're doing your low back, it's not traction, it's not decompressing your cervical spine at all.
So for someone like me that was in an accident years ago
yes.
and my vertebrae is straight in my neck, is that neck one a good option, or is it just too long, too late?
It would be, you probably wouldn't need as many sessions, but it won't necessarily put back the curve. But it actually can help put fluid back into the discs and slightly increase their height again. There's actually good evidence that shows that
We're going to have research. To do that then, because.
And auto accidents are one of pretty much the number one thing that creates degenerative changes in the neck or more severe degenerative changes. I mean, somebody can end up with some, changes in their neck just from sitting at a desk for 40 years kind of thing, right? Just not having the best posture, but it's these injuries to the ligaments that really create. So what happens is, come around here.
Second.
Yeah. So here's the interesting thing. Discs, somewhere between age 20 and 25, the body cuts off the arterial blood supply to the discs.
Really?
Yes. There's no nutrients going to the disc material from circulation. So the only way the discs stay fed, if you will, is through what they call imbibition, or what we call back motion. So but it happens with just daily activities, right? If you're looking down at paper, you're looking up, you're looking, all that movement creates a vacuum pressure and allows the seepage of material to come from the bone marrow in the vertebrae into the disc material, right?
Okay.
But what happens many times when people have had a lot of injuries and a lot of pressure, this disc material, the outside wall, tears, and then the disc can bulge up out like that. But what happens after injury, many times the vertebrae, instead of moving independently anymore, they're locked up. And so that movement doesn't happen, and the nutrient exchange doesn't happen.
If there's no nutrient exchange, can that basically die out?
That's right. That's what degenerative discs are. So they're basically dehydrating, And now bone spurs, and that's another area, but that's tears in the ligaments, and ligaments don't have much blood supply. So the body, to shore up the ligament, throws calcium in to try to strengthen it. But now if the spur goes away into just sort of soft tissue, it's not a problem. If it happens to be around ligaments that are where the nerves are coming out of the opening between the vertebrae, then you can get pain, get pressure, more pressure, or even actual physical contact, with the bone spur rubbing up against the nerve.
That sounds like a lot of pain.
Yes, and those are usually patients that need surgery. Like even that type of case won't be helped by this. So again, not everybody. So now we gotta snug up the harness. Make sure it's just snug.
Strapping in for a ride at Magic Mountain.
Yeah, something like that, pretty much. Something like that. So now we hook you up. So all the decompression's happening here, right? You gotta be hooked into these two harnesses.
Yeah.
Okay. Now, normally, this is just sort of a sample test run, right? So, you're not having chronic low back pain or severe pain. So so we don't have an MRI on you, right? You know, so then we just set it, like the sweet spot is like the fourth lumbar vertebrae, and then I'll just put you in a low, like a medium weight pull for today. Now, if we had an MRI, depending on your pain level, that determines how much weight we're gonna, or how much pull.
I feel like I know a couple people that really could benefit from
Yeah.
this and what it does and the spine, and they have like some bulge and slip disc and
Yeah,
super
it's
excited.
it's very common. There's practices all over the country that just have these tables. I mean, that's all the clinics do. And some of these offices have 4, 5, 6 of these tables going 8 hours a day.
So it's almost like a
So-
facility for, I don't know, would that be
Yeah, for
considered like rehab?
Yeah, well, I mean, some of the offices have rehab, like, you know, like strength training afterwards, and, you know, we do nutrition here, so we have other things we can add to the mix. I've got patients that are low on magnesium or potassium. There's all kinds of things that we can do on top of this to help, you know, the healing process, or help it heal faster.
Gotcha.
Okay, so we did that. Let's see. Okay, so now we turn it on.
Okay.
Wait, no, it's forgot to set it off. So the table has a glide factor in it, but we let you go through one cycle. So a cycle is about 2 minutes of traction or decompression, and well, the whole cycle is decompression. So you could say the first 2 minutes is tractioning, and then 30 seconds of relaxing. So that one cycle of contraction and relaxing is called decompression.
It's very gentle.
Yeah. So it's ramping up, and you can see here, like we're taking up to 75 pounds, so you're at 64 pounds now. So this tells you everything. This tells you, yeah, I set it for 15 cycles, so you're gonna have 24 and a half minutes. You're on the first cycle. We're gonna take it up to 75 pounds, and then this tells us the angle, so we know that's the L4 vertebrae angle. So now you're almost up to this. So slowly goes up from 0 to 75.
Okay.
You know, if I had it at 90, the same thing would take about a minute to ramp up to the 90. But it doesn't matter what we set it at. It just takes it. It doesn't go to it right away. So it's always a slow, gentle, you know, process. So now we're just processing. This tells us the time here. So usually one of the staff will come in and what we call unlock the table. Since we're doing the demo, I'll stay here. Unlock it for you. And then just so it's a little quieter, I'll turn this part off so it's not, so you can relax. You don't need the extra hum. So,
Doctor, can this fix the bulging disc, like when you look at an MRI afterwards, in which it's moved back into place?
yes, but not in one session. It might take 25 sessions.
25 sessions.
Maybe 30. Some patients heal faster, but I think the quickest I've seen research, one patient, they took an MRI 17 sessions in, and the bulge was seated back in properly.
Nice.
So
Do you come weekly or every few days?
no, it's usually it's best to do 3 times a week for the first month.
Okay.
But this city patients are busy, so we found that twice a week is the minimum. Once a week at the beginning is not
less effective.
Yeah, it's just not gonna do it. So then, some patients like to read. We can turn out the lights. It's best to relax. That's actually a TV screen there. We can actually put a video if we wanted, but then what happens? Then the patients try to look up a little too much. So sort of the rule of thumb when doctors get together, they find if the patients just try to relax and just take the nap, while they're doing it. But, okay, how's that feel? Pretty good. Yeah. Okay. So then we just leave her alone for 21 more minutes and let her. You can sit there and hang out with her if you want, but I'll let her snooze. Okay.
And it's funny, I felt at that very end where it just released.
Yeah.
Yeah.
Just do that. Lock the table. This out.
So we go up.
And ready to go up.
It was so incredibly gentle. Like it just.
Yeah. And then usually start lower than you think you really want to start, because you don't want to aggravate just the spine. So and then after the next one we done 5 pounds, and the next one for 10 pounds, and then we find the sweet spot for you. Okay, and then you grab onto these handles, just make sure that you're balanced, and come watch your first step.
Okay. Wow. Recovering into.
And here, get you.
And so, what is this machine called again?
The DRX9000.
DRX9000, which stands for decompression.
That's just the model number.
Yes, just the model. Yeah.
So, I want to come back. My friend who's here wants to come back. I want to send my mom. They're going to schedule for what exactly?
Well, first an exam and evaluation, and if they have an MRI, we want to see that. Then we can determine how many sessions they'll need.
Okay.
That's it.
And then when they're calling to schedule what session though? Like what are they telling them?
Just a new patient. Just you say, I'm interested in the DRX machine. I want to, and they can either see me or my son. So it doesn't matter.
Yeah, we have to talk to your son next.
Yeah.
So my favorite chiropractor, he's absolutely amazing. Just demonstrated this machine and decompressing in the spine and getting all those fluids in and nourishing the spine, and he's absolutely amazing. Can't recommend him enough. You guys need to come and see if this is for you.
Okay, sounds good.
Awesome. So now that you've had a chance to see what this amazing machine is all about and the benefits that it can do for you, I highly encourage you to schedule an appointment to see Dr. Ron Saltman. If you have any sort of back injury or stress in your back, lower back pain, have been in a car accident or anything like that, this is something you might want to discuss with him to see if it's a good fit for you. Also, if you'd like to get on my mailing list for discounts locally, be sure to click the link below. And I'll be sure to let you know about some specials coming up. And lastly, if you haven't subscribed to my channel yet, please do so and be sure to click that bell for updates. We update weekly. See you next time.